Many people hold misconceptions about transgender individuals. These misunderstandings can be hurtful and perpetuate discrimination. This video aims to shed light on some of the most common myths surrounding transgender identities and experiences. Myth number 1. Trans people don't have bottom surgery. This myth assumes that all transgender people have the same goals for their transition. Bottom surgery, also known as gender-affirming bottom surgery, GABS, is a medical procedure some transgender people choose to undergo. It allows them to alter their genitalia to align more closely with their gender identity. However, it's important to understand that not everyone desires or needs bottom surgery. Transitioning is a personal journey, and the choices a person makes are unique to them. One transgender woman may decide to have bottom surgery early in her transition, as was the case for YouTuber Matilda discussed in the video outline. Matilda emphasizes that the results of this surgery can be natural-looking, dispelling another misconception regarding the procedure. Myth number 2. All trans people are hypersexual. This stereotype paints transgender people, particularly trans women, as overly focused on sex. In reality, transgender people encompass a diverse spectrum of sexualities, just like cisgender people. Some may be heterosexual, lesbian, gay, bisexual, asexual, or somewhere else on the spectrum. Transitioning for most transgender individuals is not about sexual gratification. It's about living authentically as the gender they truly identify with. As Matilda shared, her motivation for transitioning stemmed from a lifelong desire to be herself, not from any sexual motivation. Myth number 3. Trans people frequently detransition. Social media and some news outlets often highlight stories of detransition, creating the impression that it's a common occurrence. However, research suggests otherwise. Studies by the National Center for Transgender Equality, NCTE, indicate that regret rates for transitioning are low, with estimates ranging from 1–5%. Detransitioning can happen for various reasons, often due to social pressures, lack of support systems, or difficulty accessing medical care. It's crucial to remember that detransition is a personal choice. While some may ultimately decide transitioning wasn't right for them, the vast majority of transgender people find it to be a life-affirming experience. Myth number 4. Men who like trans women are gay. This myth hinges on the misconception that transgender women are still men. If a transgender woman lives and identifies as a woman, and a man is attracted to her, then he isn't necessarily gay. Matilda, who passes as cisgender, uses her experience to illustrate this point. Men who find her attractive are responding to her as the woman she is, not to her assigned sex at birth. Furthermore, sexual attraction is complex and not always solely based on genitalia. Trans women's bodies can be just as diverse as cisgender women's bodies. Myth number 5. Transitioning is trendy. The idea that transitioning is a fad is not only insensitive but demonstrably false. Transitioning is a lengthy and often arduous process. It can involve social transition, hormone replacement therapy, HRT, and potentially various surgeries. There are also significant social and emotional hurdles to overcome. Transitioning can lead to strained relationships, job loss, and societal rejection. It's a path most wouldn't choose lightly. Matilda's experience in Sweden highlights the seriousness of transitioning. There, a thorough evaluation process precedes access to medical interventions. This ensures individuals are making informed decisions and receiving the support they need. Myth number 6. Transgender individuals transition for attention. The notion that transgender individuals transition solely for attention is not only outdated but also harmful. Transitioning is a deeply personal and often challenging process that individuals undertake to align their gender identity with their physical appearance. It's about finding internal peace and living authentically, rather than seeking external validation or attention. Transgender people face enormous societal pressure and discrimination, making the decision to transition incredibly difficult. The courage it takes to embark on this journey stems from an innate need to feel comfortable in one's own skin, rather than seeking superficial attention from others. It's crucial to debunk this myth and instead focus on supporting transgender individuals in their quest for self-discovery and acceptance. It's essential to realize that transitioning is a complex and multifaceted experience that goes far beyond seeking attention. By understanding the depth of the transgender experience, we can foster empathy, combat stigma, and create a more inclusive society where everyone feels seen and validated for who they truly are. Myth number 7. Being transgender is a mental illness and can be cured through therapy. Understanding and accepting the diverse identities within the transgender community is crucial in dispelling harmful myths. Myth 7. Claiming that being transgender is a mental illness curable through therapy perpetuates stigma and undermines the validity of trans experiences. In reality, gender dysphoria is recognized by medical professionals as a legitimate condition demanding care and support rather than cure. Therapy can be beneficial for individuals navigating their gender identity, helping them work through their feelings and develop coping strategies. However, viewing being transgender as a mental illness needing to be fixed pathologizes an inherent aspect of one's identity. Embracing different gender identities as normal variations of human experience promotes inclusivity and respect for all individuals regardless of how they express their gender. It's time to challenge outdated beliefs and affirm the dignity of every person's authentic self-expression without judgment or attempts to erase who they are. While this video has debunked some common myths, a deeper understanding of transgender identities requires looking beyond these misconceptions. Here are some key things to remember. Gender identity is a person's internal sense of being male, female, or something else. It's distinct from a person's assigned sex at birth, which is based on physical characteristics. Transgender people experience gender dysphoria, which is the distress that results from the mismatch between their gender identity and their assigned sex at birth. Transitioning helps alleviate this dysphoria and allows them to live authentically. Coming out as transgender can be a challenging process. Trans people may face discrimination, prejudice, and even violence. Support from family, friends, and allies makes a world of difference. Everyone deserves to live authentically and be treated with respect. By educating ourselves and dismantling myths about transgender identities, we can create a more inclusive and supportive society. While dispelling these common misconceptions is a crucial first step, true understanding hinges on amplifying transgender voices and experiences. Here are some ways to move past debunking myths and actively create a more supportive environment. Listen to and learn from transgender individuals. Documentaries, memoirs, and social media platforms offer valuable insights. Use inclusive language. Respect an individual's preferred pronouns, he, him, she, her, they, them, and avoid outdated or offensive terminology. Educate yourself about the challenges faced by the transgender community. This fosters empathy and allows you to become a better advocate for transgender rights. Challenge transphobia when you encounter it. This could involve speaking up against discriminatory remarks or policies, or simply educating others about why they're harmful. Support transgender-owned businesses and organizations. Doing so empowers the transgender community and allows them to thrive. By dismantling myths, listening to transgender voices, and taking action as allies, we can create a world where transgender people feel safe, respected, and empowered to live authentically. Remember, gender identity is a spectrum, not a binary. Transitioning is a personal journey with unique challenges and triumphs. Respect and understanding are essential for creating a more inclusive world. Let's work together to build a society where everyone can live authentically and be celebrated for who they are. Finally, we would like to express our gratitude for watching till the end. We hope you found the video valuable and informative. If so, please show your appreciation by hitting the like button and leaving us a comment below. We are eager to hear from you. In the end, we have a humble request for you. We are trying hard to keep you enlightened and empowered by creating awesome videos like this. Please support us by joining our membership program. The link is in the description. Your little contribution will inspire us to make more awesome content for you like this. The next video will be published tomorrow, so don't miss it. Till then, take care. More wisdom, more solutions, better life.